Just take care of yourself. First of all, make sure that your glucose values are normal. Be in regular touch with your doctor. Take care of your feet at home. Bathe properly. Make sure that you wash your feet properly. After taking a bath, make sure that the space between the toes is dried carefully. Inspect your foot every day after waking up, after taking a bath, and before going to bed for any corns, callosities, or any injuries. That would be one aspect. If you find that there is any injury or any infection, get it treated immediately. Many a times, home remedies may also work, but there's no harm in showing a doctor because the doctor is trained to see what your eyes are not trained to see. So do consult a doctor. The second aspect would relate to footwear. So make sure that your socks and shoes are comfortable. If you want to buy new shoes, try to buy them in the evening towards the later hours of the day because at that time your size is bigger. Don't buy shoes which are tightly fitting and don't try to fit on those shoes in the morning. If you have bought new shoes or slippers, don't break them in very aggressively. Don't wear the same pair of shoes continuously for 12 or 24 hours. Wear it for a few hours and then change. So just some basic common sense steps, and that will help us prevent a lot of missteps in foot disease.
Stress is one of the important reasons for aggravating diabetes, because once you have stress, especially acute stress and severe stress, it activates what are called as the counter-regulatory hormones. Now in the body, there is virtually only one hormone which reduces the glucose, and that's insulin. Almost all the other hormones, whether it is cortisol or whether it's adrenaline, noradrenaline, and many other hormones, they are all anti-insulin hormones. So when you are under stress, all these hormones get activated. They block the action of insulin and they can shoot up your sugars, particularly the cortisol can definitely increase. That's why when you take steroids for any particular condition, we find our sugar levels shooting up. How do we prevent this stress and how do we reduce the stress? Simple things which I think our ancients have taught us, like pranayama, meditation, yoga, having a hobby, not getting worked up unnecessarily. These habits, deep breathing is an excellent form of relaxation. Earlier it was believed that getting complications is inevitable. In fact, I remember 30, 40 years ago, we used to have a debate, should you control diabetes at all? People are anyway going to get complications. Then came the landmark trials, one by one, some in type 1 diabetes, some in type 2 diabetes, which showed that if you control diabetes well, then you can prevent complications. It has gone a bit further now, and I would like to call it as the ABC to prevent complications. A stands for A1C or HbA1c. That has to be kept under control below 7%. B stands for blood pressure. So if you keep your blood pressure under control, again, you're eliminating your chance of getting complication. And C stands for cholesterol or bad cholesterol. If you keep that also under control, then if you have followed this ABC principle, we have found that people with diabetes are able to live as long as or even outlive their non-diabetic counterparts.
Kidney is another very important organ which is affected because of diabetes. So if you look at the heart, you say that more than 3 times a risk of heart disease is there in people who have diabetes as compared to those who do not have diabetes. Similarly, in the kidney, what we see is that almost 20 to 30% of people with diabetes have some degree of involvement of the kidney, and this is a very gradual process, happens at different, goes through different stages. And once it reaches a particular stage where you have increased protein being lost in the urine, then what happens is that there is an increase. Not only is there an increased risk of progressing to an end stage kidney disease where the individual is dependent on having some form of renal replacement, that is either a dialysis or needs a transplant. But also what happens is that there is a very significant increase in the risk of heart disease also in such individuals. So the heart, diabetes and kidney are all linked together, and we can say that diabetes increases the risk of not only the heart disease but also increases the risk for kidney disease.
So first, when we call in medical science, management means one is diagnosis and the second is the treatment, right? So people those are obese, those are more prone for the diabetes and early onset of diabetes because of insulin resistance. Not only for the type 2 diabetes, but even for the type 1 diabetes also, because those are obese, they are having early onset of diabetes. Right? Then coming to the management. So the management part is basically depends on the diagnostic criteria are same, but the treatment depends on, first and most important is that to reduce the weight.
The people who are indicated to undergo bariatric surgery is different in people with obesity, and it is different in people with obesity with diabetes. We have got a lower threshold for bariatric surgery in people with diabetes. Everywhere, if you look at the guidelines, for example, if you are obese, if you are moderately obese, means if your BMI is more than 35, the current indication, worldwide is to undergo bariatric surgery. But if you have got diabetes with obesity, the current BMI cutoff is only 30. So if your BMI is more than 30 and if you are diabetic, you can undergo bariatric surgery.
Obesity, diabetes, cardiovascular disease. So one leads to the other, and then the other leads to the third. So it's a vicious cycle. So obese individuals have higher risk of diabetes. Diabetics have higher risk of hypertension and heart disease. And heart disease and obesity are also related. So these complications are there to stay. However, we were talking about sleep apnea, we talk about osteoarthritis, we talk about liver disease. There's a very fancy term called fatty liver and fibrosis liver and leading to cirrhosis. So these are multiple problems now interlinking obesity, diabetes, cardiovascular disease.
The lifestyle modification, the three important parameters is the diet, which should include low fat and the high protein diet, exercise, a good moderate amount of exercise, and third but not the least, that eating well in time, and you should have a good sleep, and the younger generation should learn that they should avoid the junk food, the high glycemic items, which is absolutely prevalent in their diet schedule because they don't get enough time to come to home and have the normal balanced diet.
If you look at science in terms of diabetes prevention, and there have been studies both from India and from abroad, just like Dr. Sambit had told, genetics is something which we cannot change. And when it comes to diabetes and obesity, both, I think we should be considering both together. Genetics and environment both plays a role. And the only place where we can really interfere in terms of outcome is when we change the environment. So what studies have shown is that when you improve the lifestyle, both in terms of either diet and exercise, and some studies using medicines, that means you are modifying the environment, you in fact reduce the risk of diabetes, if not prevent it totally.
I think we have, exercise is one of the very important lifestyle measure, not only for prevention, but also treatment of diabetes and obesity, of course. And it has got so many multifactorial advantages in that. First of all, it actually improves the metabolism. So your glucose disposal into the different tissues will be more effective. It will help in maintaining a good BMI and good weight. That is also very essential for management of diabetes. Third thing, it improves your performance, maybe your working capacity and all that can be improved. And fourth, it also de-stresses it yourself. So one of the important thing that exercise does is actually it improves your mental tranquility, maybe reduces the stress and the anxiety also. So all these factors are actually helpful in patients who are living with diabetes or want to prevent diabetes.
Coming to the actual differences that we see in the clinical world, what we see, Nutan, is that women with diabetes will have almost a much higher risk, for example, of CHD. There was almost a 40% greater risk of these patients having a cardiovascular event compared to the male patients. They almost have a 27% greater risk of having a stroke, for example. more years of life are lost at the age of 40 in diabetic women compared to men. Unless they prioritize their health, unless they accept that they are a very important part of the family, they're actually the backbone of the family, backbone of society, if I'm allowed to say that. And if they do not reach out for help, if they do not take their medications, if they do not prioritize their activity, you would rarely, often, Nutan, you hear women saying, ma'am, I cannot exercise, I don't have time. But it is the male counterpart who's going to the gym, who's, manages to take out time from the schedule. But a woman will always say, I don't have the time. Meals are always, in a lot of households, the last meal is consumed by the woman. So there are lots of differences, lots of subtle differences which exist. And I think it's very important that, to be honest, we train the male child so that we can make a difference to society. I would say that as mothers, we train the male children. I'm not sure that I'm using the right word. We make them more sensitive. We make the boys more sensitive that this is how you need to look after the females in your life. And I think that's where you'll be able to make a change.
Whenever a person who gets diabetes, they have other comorbidities also. It's a cardiometabolic disease. So it's not that the patient only has high glucose value. They have many more problems associated with it. And most of the times in India, we see a typical atherogenic diabetic dyslipidemia, where the patients will have a high triglycerides, they will have a low HDL. The HDL is a good cholesterol. So that's lower in most of the Indians. And we see that the LDL, which is a low density lipoprotein cholesterol, that cholesterol will not be showing very high value, but Indians have a small dense LDL, which is more atherogenic, means they get more predisposed to atherosclerosis. So that's why if a person who has diabetes, or even if they don't have diabetes and they have high cholesterol, they get predisposed to cardiovascular disease very early, and that has to be tackled as soon as it is diagnosed.
The recommended levels to diagnose diabetes are fasting equal to or more than 126. Fasting is in empty stomach after 8 hours of not eating anything. PP or postprandial blood glucose, which is known as PPBS, that is more than or equal to 200. And we have something else called HbA1c, which gives us an average value of the blood glucose levels in the past 3 months. So an HbA1c of more than or equal to 6.5% is type 2 diabetes, or is diabetes. So now when we are talking about, so these are the levels that are used to define in order to diagnose diabetes.